Hi everyone, welcome to Medechart. My name's Andrew and I'm going to take you on a brief walkthrough of how to use the main features of Medechart. So here I've selected a patient from View Patients. This is John Hancock, he's made up. We're going to do a new consultation for him. Click on New Consultation and it takes you to the consultation page, and you'll see there's 3 different body charts. So we've got muscular, skeletal and surface. We'll start with surface. On surface we can measure pain and range of motion. So we'll take some notes first, just for the sake of simplicity. We'll say lower back pain, but you can write as extensively as you like. We'll save that, and then we're going to rotate the diagram and click on his lower back where he's getting the pain. Okay, we're going to select that, save, and then we're going to go up and click on it again and measure. So we've got different measurements here. We've got all of his range of motion. Now these ones are in degrees. There's our visual analog scale, and these ones are in percentage. So this would be asking the patient, how far can you bend, and what percentage of normal is that for you? So let's say, for example, he's having trouble bending. So we'll select that. We also want to know how much pain he's in, visual analog scale. So on the visual analog scale, he's getting an 80 out of 100, and flexion he's only getting to, let's say, 50%. Okay, so we'll close that. We're now going to have a feel of John's back. So got him on the treatment table. It's his left hand side that's painful, so we'll select that, and he's getting pain in his quadratus lumborum, so we'll save that. Again, clicking on it, measuring it. We've also got next to visual analog scale, we've got the pressure threshold and tolerance if you're using an algometer. But just for the sake of simplicity, again, visual analog scale, and he's getting an 80 out of 100 on that as well. And then finally, on the skeletal chart, we're going to feel the lumbar vertebra, and he's got pain at L4. So we're going to save that, and again, measure it, and that's a 60 out of 100, so not as bad as the muscles. Okay, so when you've taken all your measurements and your notes, you save it. Okay, there's also the option, so here are the notes down here. There's also the option to hit copy to a clipboard, and then you can post that note into a different practice management system that has a text box. So that's just Clinico that I'm using there. Save that, and that saves you having to type all that much. Going back to the chart again, let's say now he's come in for a new session, or you wanted to repeat those tests after your treatment. So we hit repeat. All of the previous tests are already there. You can make some notes, so just listing what treatment you did. Save that. Click back on these again and measure. And now this time his visual analog scale after the treatment's come down to 30, so it's dropped significantly, and his ability to flex is now up to 100%. Okay, so he's feeling much better. We go back to his quadratus lumborum, we measure that, and look at that, he's feeling a lot better there. Okay, and then we go to the lumbars, visual analog scale, and his L4 is feeling a lot better as well. So we close that and then save it. And now we go to view charts, and we can start seeing a trend in John's lower back pain. So for his L4, he's been in a few times now. It's been going up and down, but it's a lot less painful after these last couple of treatments. Here we've got the range of motion as well. So he's started off quite low, only 20%, and over time he's gone right up back to normal again. And same for quadratus lumborum. That hasn't changed all that much. So we can just save that. That's all done. And that's how you do your notes and measure your variables for your clients. Thanks for listening, and happy Medecharting.